Hello. Hello, good afternoon everybody, and I apologise for the late starting of this webinar for this afternoon, but unfortunately we've had just problems getting two of our speakers, Daniel Hartley and Stuart Palma, into the live link. So I'm very sorry that they're not going to be able to sort of just give their introductions here today, but they will send through you know, what they were planning to sort of say to support us in this event, and we'll make sure that comes out to you too. So it is a warm welcome to this event, which has really been planned as part of our regional National AHPs Day activities, and we really hope it will be a catalyst for further conversations and actions. I think we all realise that this past year has highlighted many issues affecting staff from a BAME background. We also know that it's a right for all staff to feel included and valued for their work. And sadly, evidence suggests that this has not always been the case for staff from a BAME background. This webinar aims to present the evidence, share experiences, and really act as a call to action for AHPs across our region and beyond to understand that we all have a part to play in being really inclusive of all our staff. So it is a reminder also before we start that this is a live event, so unfortunately we cannot take your questions personally, but if you can put any comments or questions in the chat, we will definitely note these and make sure that they're sort of circulated out to everybody. If anybody has a question they particularly want answering, if you could leave us your email address, that will be really helpful. Maureen Drake's going to keep an eye on the chat, so thank you Maureen, and we'll come back to you later. This event is also being recorded so it can be shared more widely with AHP teams across all our region. And I think just before we start, I would like to say a thank you, a personal thank you to all our speakers for supporting us today, and also to thank you for making time in your extremely busy days to join us on this webinar. So thank you everybody. So I'm delighted to welcome now our first speaker, who is Arnie Pontis, a HE clinical fellow who is in very high demand at the moment. So we're very fortunate that you've been able to join us, Arnie, and share with us your experiences. So thank you very much, and we look forward to your talk.
Lovely. I'm just going to share my screen. Make sure the technology all works. So hopefully you should be able to see my screen. So my name is Arnie Pontis. I'm a physiotherapist by background, and I'm a clinical fellow working with Health Education England. And I was invited to come and speak to you about the work that I've been doing, not in the Northeast, but down in London, to kind of give you a bit of a flavour of what we've been up to, and maybe things that you might want to kind of do up in your neck of the woods. So to start with a bit of data. And this is London focused. And when we look at the population of London, we can see that there's 60% of the population are made up of people that identify as being white, and 40% would be from a BME background. When we look at the NHS workforce, we can see there's actually a 50-50 split between people from white and non-white backgrounds. But when we look at AHP specifically, and that's what we're talking about today, there's a huge variation. So within London, we can see that 77% of our AHP workforce from white backgrounds, which doesn't meet our local population. And this information is also quite similar on a national level, which is what Stuart was going to share with you today. And unfortunately, he can't make it, but I'm sure he'll be able to send his slides that kind of show the national level data. So that's why it's an issue, because we want our workforce to be representative of our local population. We have better health outcomes if we do that. And it also feeds into that sort of population health area where we have people in employment, we have people who are employed who know the population that we're treating. So what we can also see within the AHP world, and this is no different in London compared to nationally, compared to lots of other big organisations, is that as we go higher up the bandings, as you can see, the population of BME staff gets lower and lower. And so there's that issue with not only the number of people entering the profession from a BME background, but also people staying within the profession and that level of career progression. So at the beginning of the year, when COVID-19 was sort of experiencing the second wave in London, I did a series of listening events And it wasn't a research study, it wasn't anything that sort of fancy. It was just a come and chat to me. We know that you're going to be adversely affected by the pandemic and the second wave, because we saw it in the first wave. And rather than wait and see what we can do after the event, I kind of held some listening events to say, just come and talk to me as part of HEE, and let's see what we can do. So within that, there were students, there was workforce, there were managers, there was all sorts of people, all from BME backgrounds. And this slide kind of summarises some of those experiences that people were having. So although there were some things that were specific to COVID, like the risk assessments and the vaccine, there were also issues around, just not having that sense of belonging in the workplace, being the only Black person within their department, not feeling able to actually speak up, having the risk assessments done differently, the same things written on the risk assessment for a Black person compared to a white person, but a different outcome happening. So these were things that, were obviously difficult to hear, but also kind of really shone a light on problems that I personally already knew existed. But in a way, having this kind of evidence was then quite useful to be able to take to other spaces for other people to hear what was really going on the ground. So from the listening events, we kind of created a video resource which kind of has those lived experiences in it. And people that came to the meetings didn't want to be identified for obvious reasons. But what I'd like to do is just share the video with you, just to give you a little bit of insight into what people were saying and kind of how bad the problem really is, I suppose. And this is in the capital city where we have the most diverse population and the most diverse workforce. But just because we have diversity doesn't mean that we have inclusivity. So, hold on, I've gone back on. Here we go. We should start then.
Seeing a lot of the critically ill patients, all looking very similar to myself, having that link between morbidity and mortality for BAME people coming up, not knowing what that risk was and why that risk was there for our community. It was a scary time.
I remember when it was approaching my risk assessment, you're BAME, tick. Any other health conditions? No? All right, you're fine. I never felt so Black.
The people who continue to work, the people who continue to travel, the people who did not take up the work offers like working from home, they were all people of colour. In those conversations around risk, the wider social determinants of our health and the health of the people that we live with was never taken into account.
I sometimes say to colleagues who are BAME, you know our white colleagues sometimes don't get it. They don't experience it. You know when they are going through their career progression and things may be full to them, they cannot relate to how hard I had to work and the things I had to do.
Ever since I qualified, I was just really needed to prove myself. I've worked really hard to progress every stage of my journey. My first 3 months has always been about apologising for my behaviour, adjusting, managing my managers. Once you're in a routine, okay, but for the first 3 months, you can forget about being yourself.
We know that as you get more senior within the NHS, it just gets whiter and whiter.
Microaggressions from other staff and patients, it wears you down. You don't report it because nothing is ever done.
By email, the person I was talking to was very nice and accommodating. As soon as she saw me, it was a different thing. And I think sometimes my name doesn't actually sound very ethnic to people. They might not get the impression that I'm actually Black.
Representation within the NHS is just not there at all. I look at other colleagues from nursing, you'll get someone from BAME a lot at band 7 level. You go into matron, there's only 1, maybe 2, and as you go up to directors, there is not anyone at all. It's like, oh, they want diversity, but they don't actually want diversity, really.
You tell your story and people don't believe you, or they say you've misunderstood the intention. I can't trust a system that lets us down again and again.
What I hear a lot is, you're great, you do an amazing job, you're an asset. But there doesn't seem to be anything to back it up in terms of representation. I'm told there isn't the funding or support for now, but be patient, stick with me. But for how long can a person stick with you?
Learn a person's name. Time and time again, people just get called the same name as another person of colour. It's getting tiring. It's all about your identity. It's about learning who that person is and giving your time to show you appreciate their value as a person.
People are often scared to say the wrong things. People sometimes tiptoe around your ethnic origin. We are comfortable with who we are. If you have questions, just ask. We can't make positive changes if we are not talking.
That's a really powerful video, and I help produce it. I listen to those stories and I've watched it hundreds of times, but every time I watch it, it still gives me goosebumps to think that in this day and age that we live in, that those things are still going on. And I think for a lot of people who might be listening who do identify as being from a BME background, that might resonate and that might trigger some emotions within you. And for those people who maybe have hearing this for the first time, it can actually be quite upsetting as well to kind of think that could be my colleague, that person that sits next to me in the office feels like that, and I have no idea that that's what they're experiencing at the moment. So what we did after the listening events was we used that information and we fed it back. I fed it back to anyone and everyone who would listen. So back to the chief AHPs, I fed it back to the universities across London wide, not just specific universities. I've been linking up with the Res team in London to try and work out what work they're doing and how can AHPs be linked into it. How do we get AHPs foot in the door so that all that amazing work that the Res are doing, that we can be part of that as well? How can we get invited to things? How do we get our name in those meetings? I've then also set up a variety of different groups to try and get some of the work streams going. So this looks like quite a busy slide, and I'll leave it up there just for you to have a look at, but it's kind of split into three main categories. So growing the future, thinking about how do we get people into the profession. And we're going to commission a piece of research to look at how do people from specific ethnic communities choose careers, and therefore how do we target our interventions to get more people in. We've got a careers ambassador program going. We're looking at kind of student experience and actually what are those main work streams within the student world that we need to focus on. And some of the things we're going to be looking at is the the kind of complaints and disciplinary procedure around what to do if you experience racism as a student. What's the reason that people don't speak up? And we know the reasons, but actually what do we do about it? And we're also doing safe space networks so that people within organisations have somewhere they can go to meet with other people and to share their experiences, to have an action learning set where we can learn and draw from each other's combined skills and successes, and also help to support each other, as well as having kind of speakers come to talk to us about career progression and interview technique or other aspects like that. And also looking at transformation, so thinking about debiasing recruitment, providing written guidance on how to, one of the things with written guidance about COVID vaccine, and also doing pilot projects thinking about how we combine supervision and EDI. So it's been a busy few months since I started in December, almost coming up to a year now. But that's what I've been up to, and I'll put any questions. If you do have any questions, please just feel free to type them into the chat. And I think the organisers will be saving and sharing my email address as well if anybody wants to get in touch. Thank you.
Thank you, Arnie. Some very powerful and challenging messages there for us, and we really do thank you for sharing them with all of us for some serious thought. Now, our next speakers are going to share some research findings that they've gathered from BAME students, and so it's a welcome to Claire Gardiner, who's a Senior Lecturer in Dietetics, and Dr Alison Murphy, Senior Lecturer for Occupational Therapy, both working at Leeds Becket University. So thank you, and we look forward to your presentation.
Hi, so I'm Angela Murphy. I think we've lost the slides. Can other people see them? But there they are back again. So it's, yeah, so Angela Murphy and Claire Gardiner. So we're speaking on behalf of the School of Health from Leeds Becket University, and we're talking about some research that we carried out last year, just at the beginning of the first lockdown. So it was on the back of some work that we've been doing within the school around looking at ways to increase awareness and improve experiences of our students who are from BAME backgrounds. We're aware that the term BAME is outdated now, and we do apologise that we are tending to use that within this presentation in the want of a better term. So the research was carried out during lockdown last year. We carried out 1 focus group and 5 semi-structured interviews using Skype in March and April. The interviews and the focus group were recorded and transcribed verbatim, and analysis was conducted using thematic analysis and also the theoretical lens of possible selves. And we chose this theoretical lens because we wanted to kind of consider how why and how people were choosing AHPs, AHP professions, but also in kind of throughout the analysis, we've been also thinking about our possibilities for our kind of AHPs as well. So looking towards the future and how we might want to kind of improve, but also attract more people from more diverse backgrounds as well. And it seemed like the most sensible thing to do at that point was to ask, about the experiences that the students were having on our courses at that time, to find out, were we doing a good enough job, or was there a lot that we needed to improve? So Claire's just controlling the slides, thank you. So the demographics were that all the participants were female. They were age ranged between 40 to 45 years, and their ethnicities were, I'm just going to look at my information here as well. So their ethnicities, where we had 3 who identified as Black, 4 as Asian, and 0 from other minority ethnicities. And yeah, the process that we kind of went through an initial analysis phase where we identified some themes and some sub-themes. So I'm going to talk to you about the applications theme and some of the sub-themes within that, and Claire's going to talk you through some of the others. So, okay, so within the sub-theme around kind of the early days, first contacts with university, we wanted to know about people's experiences, and some of the participants reflected on their experiences pre-application and considered their socio-economic circumstances and the challenges that they were kind of coming from within the areas that they were going to school. And one participant, student 6, talked about, and she gave us this quote here: so if you're brought up in a predominantly poor area, and then you're going to have this preconception and predisposition to think that you're not going to be able to be as good or succeed as well as somebody else. And obviously here she's comparing herself against people who are going to private school and also white middle class kind of students as well. So just moving on. Also, there was a real theme around the lack of role models within the university, but also within practice placements as well, and not just from a personable point of view, but also from the materials that university was using, and some of the examples that were being used. For example, we use lots of case studies, that type of thing, and there was a real kind of mismatch between those students' experiences and the kind of like always coming up against examples of people who were always white. So as you can see from this quote here, it's always a white person, always, which is quite interesting. And it's quite interesting that they hadn't really noticed this until this conversation was kind of started. And then the cultural expectations. So these students, some of them talked about being pulled in different directions and having ambitions themselves to become an AHP, So they were occupational therapy students, dietetic students and physiotherapy students specifically. But some students talked about how, becoming an AHP wasn't part of their kind of familial possible selves. So they had to kind of resist and were being pulled in different directions. They had obviously their own ambitions, but also had people saying to them, well, you should be married. And this student here was saying, I'm 24 now, I started the course when I was 22, but if you're in your mid-20s, you should be married, you should have a husband and live with your husband and serve your husband type thing. So a real kind of mismatch between what that student wanted in her life and the way she was being pulled by her kind of family, which just gave us a little idea of some of the challenges that some of the students are experiencing. And now I'm going to hand over to Claire.
So the other themes we were looking at was the experience during the course. So we got a feel for the application process, but actually their experience when they were actually on the course. And we got 5 themes that pulled out of experience during the course. The first one was, I can't afford this. And what we found was home students, the participants, were acknowledging the challenges associated with working while studying because they felt they had no choice but to work in comparison to peers who appeared, I guess, financially secure. And not only was it the impact of their socioeconomical status that factored as a cause, but also the fact that financial independence was also a cultural expectation as well. So while one student acknowledges the difference in observation, so they said what you're spending all your money, basically looking at others spending the money, what you're spending all this money, and I literally can't afford to go shopping right now. I can't afford to buy groceries. Really impacted on that observation in terms of the difference. Another peer said they were asked, well, why do you work? Why don't you just give up your job? Which really shows a huge lack of understanding from those that were surrounding that student. The other theme we were looking at was also that was not about me, and this draws a little bit on some of the comments that Angela said at the beginning there in terms of identification. So one student draws upon experience of the course where they basically form or acknowledge the misrepresentation that appears seems to be common within the learning environment as well. So she found discussions around conditions were labelling ethnicity as a risk factor, but not particularly discussing that within the context, so it felt quite offensive. So their comments were, you wouldn't say this was a white person's disease, but it feels like that when you're discussing those diseases. In terms of where am I, this student also reflected on the communication as well, which seemed to be a common issue within the learning environment, where there seemed to be a lack of clear inclusivity in the teaching environment. So not only in terms of the lack of resources, but the expectation that the student is not conforming to the norms, they're not white-centred, and therefore they just have to find that information out themselves or just fit in. So it was upsetting actually to read this in terms of that the student had gone through this experience in terms of saying, I'm not Caucasian, and somebody said, well, just pretend that you are. There was also other examples in terms of case studies where it was just English names that were being used. So saying things like, we always just get English names like it's John or Lucy, and they don't even associate that this would happen to somebody else. Another comment was around it's not fair. So this was a sub-theme captured around how the students compared their learning experiences in comparison to white students on the course. On a positive note, they were acknowledging that lecturers considered students' learning styles and used different approaches, which was really positive. But we found that those that we interviewed, at least 4 out of the 7 had a learning need. And although support was provided within the actual teaching environment, students were saying that this was not always perceived in the right way and therefore impacted on them. So as it says, you know, when things go wrong in the course, because of my disabilities, it affects me immediately. I notice it immediately and I say it, and they'll dismiss it and say, oh, it's just because of your dyslexia. But then the student goes on to say, when a few weeks later somebody else raises it, then actions are put into place, and by then it's too late for me. Single me out was the final part that we identified, and this was brought home. It really brought home actually how central services within the university, and obviously this is a government requirement, it didn't consider the impact of the processes on particularly the international students, where they had to prove their attendance by getting their papers signed 3 times a week so it would support their student visa, and it singled them out. But conversely, other students were saying, especially international and home students were saying, we're not acknowledging their cultural needs. We're not sort of acknowledging that their sort of cultural, their celebrations were not sort of acknowledged, particularly when they go on clinical placement. I'm just going to wrap up. There were some positive points that fed back to us, really positive things, and I'll leave those slides there so you can read them as you go back through the recording. But again, it was around getting action straight away, and also getting the support from disability support services. But just really to cap off the plan going forward as a result of this this research, it was really heightened the conversation within our school, but also highlighted the conversations we should be having within the school, the institution, and also our professions, because actually that, you know, some of the comments that are made, we think that we're putting things into place, but actually it's not always the reality. So we default to what we think is right, but actually until we're being told and listen, we don't really know how we're going to react or whether we're putting the changes in place. There are other things I think to take into account, and I will be quick to cap this off, but we need to consider our own positions, our own real flexibility. So we need to educate ourselves if we're going to support culture change. What we're putting into place certainly within Leeds Becket, our School of Health, is we're ensuring that all staff are trained around unconscious bias, especially if they're interviewing or they have first contact on open days. And we're also empowering students to share their experiences, particularly from placements and within the learning environment as well, and centrally trying to create opportunities for students to direct those conversations so that they can hear their voices are being heard. So we have different forums within the university, but also within our school as well, looking to promote a talking group so students know that information can be shared safely, but that there'll be a process to escalate that as well. And also to encourage in terms of our white students as well, so that we are reinforcing the allyship as well. We're encouraging BME champions that have been coming in to share their experiences and talk about career clinics and show that there is change happening with the NHS, even if it's just one small step at a time. As our student says, we just need to keep in mind that we stop using white as our invisible norm. Thank you for listening.
Thank you. Thanks very much to both of you. It's really, really important we hear this, isn't it? You know, these students are our future, and we really must take notice and act on these findings and sort of look at these sort of things across all our universities and services generally. Thank you. Now, our next speaker is Claire Fuschina, who is a lead for the AHP faculty in West Yorkshire and Harrogate. And she's kindly agreed to share the work that they have been doing. So we look forward to hearing about it. Caroline, thank you.
Fantastic, thanks everyone so far. And yeah, so I'm Caroline Fuschina, I'm the AHP faculty lead for West Yorkshire and Harrogate. I'm just going to talk through some of the changes we've made so far in the past 6 to 9 months. Can I have the next slide, please? Just leading on really from Claire and Angela's presentation, because it was part of their findings that really spurred the actions that have happened in the AHP faculty on. So given the national and international events of the past year, and from hearing from Arnie, Claire and Angela this afternoon, it's never been more crucial that action is taken and that the culture within healthcare ensures that everyone feels that they belong, in particular when we continue to improve experiences of people from ethnic minorities. So following on from the research that Claire and Angela completed earlier last year, in the AHP faculty, we then moved on and did a questionnaire across the whole of the North East and Yorkshire region with BME AHP staff members, and I just wanted to share some of the findings from that before I move on to the actions that we've carried out. So the first finding that we found was around I have no role models. So this was in relation to the need for active promotion of AHP careers to young people at schools, but also within other communities. So faith centres, sports clubs, social media, and for there to be people like them in leadership positions. And this was really around, sometimes it is around interacting with families as well as with the individuals, as Claire and Angela found in their research as well. The second was around breaking the glass ceiling. So this was focused on equal opportunities for Band 7 and above, equal opportunities for continued professional development, and that changes need to be made to recruitment processes to reduce the risk of unconscious bias. And then finally, the third point that came out was around being an ally. So that all staff should be actively encouraged, including access to appropriate education and training in allyship, and that steps need to be taken to increase cultural awareness of the workforce. So this can be around, for example, religious and cultural events. Just thinking about the data as well. So Arnie's obviously shared the data from the London region, but thinking about the North East and Yorkshire region, the healthcare system has varying levels of BME populations. So this ranges from 2.9% in Scarborough to 23% in Bradford. And then when we think about the diversity of our AHP workforce, it is generally lower than the populations that we serve. So as an example, in Leeds, the BME population of the general public is 18.9%. But then when we look at our workforce within Leeds and York Partnership Foundation Trust, it's only actually 5.3%. So we are nowhere near representing the population that we serve at this point. Can I have the next slide, please? So just wanting to highlight now the work that we have done in the AHP faculty. So I'm going to talk through 4 elements that we have achieved so far. So this is the Workforce Ambassador Network, the Aspiring Allies campaign, the Interfaith Calendar, and then the Best Practice Guide to Recruitment. Can I have the next slide, please? So the first one I'll be talking about is the Workforce Ambassador Network. So this is a network of staff. It is open to all, but we have had an emphasis on trying to increase the diversity of those involved in career events. So this network of staff are enthusiastic and engaged in speaking at career events and sharing their journey into the profession and their role. And so far we've been involved in numerous events in schools and with career advisors, and we've got some upcoming events in the near future, and we're looking now to branch out into the other communities, because initially we have focused on schools, but we do recognise the importance of promoting AHP careers in faith centres and sports groups. And something that we have got planned for this weekend actually is a parkrun takeover in Leeds and Wakefield, where we'll be interacting with the general public. So that's the Workforce Ambassador Network. Can I have the next slide, please? So then moving on, so the Aspiring Allies campaign. So this is focused on the promotion of AHP careers. And again, this is through a lens of equality and diversity, and our recognition that we did need more role models from diverse backgrounds promoting AHP careers. So the Aspiring Allies campaign involves a website, a printed workbook, and also social media. And it is focused on 14 to 17-year-olds, so those individuals thinking about what are they going to choose for their GCSEs, their A-levels, and further training. The website obviously includes information on all of the different allied health professional roles and links to other resources, but something that is really different about this website is it has a section where it's called Find Your AHP. So it has a quiz specifically focused on individuals looking at their interests, their hobbies, what kind of person they are, to try and support them to find the most appropriate allied health professional role for them. And it also includes a section on inspirational stories. So these are stories from local allied health professionals from very diverse backgrounds in lots of different roles, talking through what inspired them to move into their profession of choice, what's their career journey looked like so far, and that we have it includes students as well as those in leadership positions. So it's really trying to address what we found in the data and the feedback around not having role models, and trying to put role models out there for people to see. We'll be actually launching this website on AHP Day next week, so it will go live on the 14th of October 2021. Can I have the next slide, please? So another thing that we have actioned in the AHP faculty in the past 9 months is an Interfaith Calendar. So this was actually developed by one of our AHP students who was with the AHP faculty. So Alice Trull, who's an OT student at Leeds Becket, and she pulled this together while she was on placement with us. And it's a calendar that includes all of the religious and cultural events across the year, so that we can, sorry, frog in my throat, support cultural intelligence and awareness for staff, students and service user needs. And this has been shared out across the region, and we've had really positive responses so far, and we're hoping to update this for next year. Can I have the next slide, please? So then the last thing that we have developed is a best practice guide to recruitment. So as we found in the data and the feedback from the research, is that there is a lack of BME representation at higher banded roles, and that they have less opportunity for continuous professional development. So this best practice guide is, it looks at every stage of recruitment. So it's not just about the interview process, it's right from how do we promote AHP careers, how do we advertise posts, what do we write in the advert, right through to the interview process. And it includes a readiness assessment that has a number of prompts. So, for example, does your career resources reflect the diverse makeup of the workforce you're aiming to attract? And then an assessment. So are you doing that? Could you improve, or you're not doing it at all? And then has a number of actions for you to progress on those points. So for example, in that one, it would be to review the images and photo material through an inclusion lens. And like I said, that takes us through the whole process of recruitment. Next slide, please. So how do these pieces of work benefit West Yorkshire and Harrogate and the wider North East and Yorkshire region? So they are hopefully actively promoting and increasing the diversity of AHP professions. They're actively working to increase future workforce supply. We're hoping to increase the awareness and understanding of equality, diversity, and inclusion. And then finally, encouraging allyship and taking positive action. Can I have the next slide, please? So what now? So we've developed these 4 pieces of work. It's not a case of sitting down now and patting ourselves on the back. It's actually going back again to looking at the data and looking at the evidence, because we're, like I said at the start, there's quite a way to go. Can I have the next slide, please? So this is just an example of information within the North East and Yorkshire region. There's one of these for, I will wrap up in a moment, for each of the ICSs. So just as an example, South Yorkshire and Bassetlaw, if we look at the banding, as Arnie highlighted in London, when you look at the higher banded roles, so band 7 and above, the representation of non-white staff members is much lower, and that can be seen across all 4 ICSs within the region. So if you just flick to the next slide, so West Yorkshire and Harrogate, the next slide please, Humber Coast and Vale, and then finally the North East and North Cumbria region. So showing similar data across all 4 ICSs. Next slide please. So I think it is really important to go back to that data to assess. There has been improvements, but we do have quite a way to go. And then my final points really are that taking small steps can lead to big changes, and that there is always the ability to do more. That's everything for me. Thank you.
Thank you, Caroline. Thanks for all the work you've done on this in West Yorkshire and Harrogate. And it really does show how, you know, by starting the work you've done, you've really started to make change happen. So we hope that can be taken back further and wider across our region and beyond. And thank you for sharing it. Right then, so our next speaker, it's a special welcome to Claire Arditto, who's just started a new secondment as our HEE Regional AHP Lead. And kindly, within 3 days of starting her busy new job, she agreed to come today to share some of her own personal reflections regarding equality, diversity and belonging. So it's a very warm welcome to Claire, and thank you.
Thanks very much, Suzanne. So yeah, thanks very much for inviting me to share with you my thoughts and reflections about allyship and how we can all contribute to this really important subject. And in preparing for this presentation, I've been feeling quite reflective actually, as I thought I've been doing reasonably well, a little bit of progress on my learning journey and commitment to the EDI agenda, but I thought I'd just start to make a bit of a mental list of where I'd focused my efforts so far, and particularly over the last few months with the Black Lives Matter and race equality being so prominent in all aspects of our lives. So a number of things sprang to mind. Firstly, that my prior knowledge and understanding was quite patchy. Secondly, that I really am committed to improving my knowledge and understanding. And thirdly, that I need to probably question, have there been any occasions when I could have spoken up or could have shown allyship? So for those of you who are just not quite sure about the true understanding of the term ally, I looked again at the sort of a general discussion about it, and this really means a lot to me, this statement here. So allyship is about building relationships of trust, consistency and accountability with marginalised individuals and or groups of people. Although you might not be a member of an underinvested or oppressed group, you can support them, make the effort to understand their struggle and use your voice alongside theirs. So having revisited the definition of allyship, I then started to explore my personal experiences. In as much that I'm a white person with significant privilege in both my personal and professional life. So I've used this really good demographic, really good picture, visual representation of the 7 A's of authentic allyship. And I use this to help me really explore where I'm currently at on my journey. So I've definitely got the appetite, and some of you will know that I've been involved with the Charter Society Physiotherapy Council for a number of years now. And we agreed as a collective to step up as leaders of the physiotherapy profession, to set an example and recognising that the council as a whole wasn't visibly diverse. So we did a number of things. We actively engaged with the diversity networks. We offered shadowing to members of the BAME community, and we co-opted a BAME representative to council. And this did start to help us to challenge and to consider a wider, more inclusive perspective. And then we've also latterly been working to support the establishment of a strategy around EDI, and that's more or less complete. But looking back, I feel that this possibly could be still considered to be relatively superficial, and I needed to start asking more questions. So in my role that I've just left actually at Harrogate District Foundation Trust, our Chief Executive supported us to acknowledge and expand our knowledge and learning. And he sent us all a copy of the book White Fragility by Robin DiAngelo. And he suggested podcasts and webinars. So I've actually started to really delve into, explore my understanding and to really seek to understand more deeply. And I've certainly always accepted that there's a problem. It's been difficult hearing firsthand, and I've heard numerous, the video just that was shown earlier was really, it made me really think more deeply about some of the things I've heard and some of the microaggressions towards students on placements, and in particular, difficulties for Black colleagues who might want to gain career progression within the NHS. But I suppose my thoughts are that perhaps I just hadn't sought to hear this enough. And recently I've been hearing from some Black leaders in Health Education England, some of their lived experiences during this current month of Black History Month. I've always acknowledged there's a problem. I've tried to take more proactive steps forwards. I've also offered some mentoring support to an individual stepping up to CSP Council, and I'm continuing to do that to enable her and to work with her and to understand her issues, as she's now been successful in a 4-year term of office. I've signed up to a reverse mentoring scheme. I'd like to learn and develop from others in less privileged positions. But really, I think I'm only at the start of my journey, and I think it's important that I haven't really got to the stage of apologising, taking more demonstrable action, and all of these things are still a work in progress. So I've tried to understand where my truth is. Where am I on this journey? And I think I've still got a huge amount of work to do. You can see that first ring as some of the things that I have started to do. But being honest, have I really come forward? I don't think I have. It's not really up to others. It's about how I own this and how I really make a demonstrable difference. And I do want to make a difference, and I really do recognise that we are all in this together. It's important for me to take personal responsibility, and it's the right thing to do. And I hope that all of you today on this call realise and really do acknowledge that this is everybody's business, because it's definitely mine. So in the little speech bubbles around the outside here, there's some of the things that I want to do more of. One of them is to be more curious, to ask more questions, to understand and seek to understand those lived experiences of colleagues and people who are working alongside me, to speak out and to challenge. And I did observe some behaviour the other day where somebody, a white person, who said, well, if I was a black person, I wouldn't like that. And I just actually said, well, actually, you're not a black person, so we'd need to hear their interpretation or understand their viewpoint on this. So it's important to just challenge things when we're not sure that it's the right thing that's been said. To definitely focus on others. This isn't about us, this is about the experiences of everybody else. And also to understand that we perhaps do need to create more safe spaces to have these conversations and to really challenge ourselves. So I've just put some key pointers here for things that we can all be doing, and I hope that after today's session, perhaps you can all go away and think about, you know, some of these actions that we can all take forwards ourselves. Finally, I'm just going to pop up a little list of some additional learning and reading, because I think we all need to perhaps explore some of the information that's out there to help us to deepen and broaden our depth of understanding around this subject. And some really interesting podcasts as well, if you're into that sort of thing, and which I've really enjoyed listening to and have helped me to sort of understand my knowledge. Thank you very much for listening.
Thank you, Claire. That was really useful, and thank you for your honesty and sharing those experiences, and perhaps, you know, how you've used that allyship to sort of frame and think about what you've done and what you're hoping to do more of going forward. So thank you. So finally, last, we are getting through time, but it's a last but absolutely by no means least, I would like to introduce Ruth Mhlanga, our Interim Chief AHP at South Tees NHS Trust, who really has done so much to inform our Regional AHP Council on equality. We thank you for that. And she's going to just give us a very sort of a quick update on progress with the National AHP BAME Strategic Advisory Group and her role within that. So thank you, Ruth.
Okay, thanks a lot for giving me this opportunity to talk about what is happening nationally. I thought I'd use this opportunity to just make you aware of a recently launched group, which is the CAHPO BAME Strategic Advisory Group. There's a clear governance structure within that group that feeds and supports Suzanne Rastrick and her team, but is also going to be working very closely with the rest team. And we are hoping that in the long run, we'll also have a post which will be supporting us as well as a group, but that is currently being worked on. But I thought I would also reflect on our progress so far and on this webinar. It's really sad that each time I hear these things that are not new to me, like Annie said, I still get goosebumps. I've got experiences of my own that I've shared within the network, and unfortunately, I still nod and I still become sad because it's true. But we talk about res data, we talk about having more representation within these higher bands. But is that success? What does success look like? Does success translate into more people being in those roles? For me, that's not the only definition of success. Success for me is when the lived experiences of those people from a BAME background are better. It's when those individuals who currently think that this is worthless, who don't bother reporting their experiences, suddenly are willing to come forward and share their experiences. It's when our freedom to speak up guardians stop collecting information anonymously because people are willing to share their names. That is what success looks like. It's when you don't just invite me to the party, it's when you invite me to the dance floor. When we dance together hand in hand. My challenge to you is use your personal power. You all, your allies, you have power. You are our allies. Use your personal power to speak truth to power. Use your power to make the experiences of those from a BAME background better. Like Annie said at the beginning, we know that when the experiences of staff from a BAME background are better, that usually translates to better patient experience and better care. Ultimately, we're all in healthcare, and that is what we're here to do. No more tick boxes. I will refer you to another book that is another published document by Roger Klein, which is entitled "No More Tick Boxes." If you need support of what good looks like, I will refer you to that book, to that published article. If you put me in a post today as a director or of AHP, wherever I am, will I still be in that post in 2 years' time? Will you still continue to listen to me when I speak? Or are you going to continue to translate what I say and say, oh, Ruth meant this, or what Ruth means to say is this? I can speak for myself. Give me that autonomy when you give me that role. Come and invite me to the dance floor and let's dance hand in hand. That is what I have to say.
Thank you, Ruth. Some really, clear messages for us all there, and I thank you very much for sharing that with us. So thank you. Well, I think looking at the time, we definitely haven't got time for questions, and I think so we will do what we said we'd do and gather all that together later. Now, we promised the packed agenda with different perspectives, and I really hope we've achieved that and you found this informative, thought-provoking, whilst I am sure all of us have found this challenging and really uncomfortable at times too. I think that's perhaps necessary feelings, because it's not until we accept that there's problems that we actually make positive steps to address them. And on everybody's behalf who's listening to this webinar, I would like to really thank the speakers for their most valuable contribution, and also, apologise for those 2 speakers we didn't have who really did want to be here today. But finally, for me, I think in listening to what we've heard today, I would really have a special ask of all AHPs as we celebrate being part of this AHP family on AHP's Day. And that is that we all find a moment now to reflect on what we've heard and consider how all of us individually can be a better ally and make at least one personal commitment of something we're going to do going forwards now. If all AHPs across our region can genuinely do this, we really will be taking those first small steps towards the big changes that we really need. So thank you very much for listening, and thank you all for today. Thank you.